Well, good evening. My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I'm delighted to welcome one of my new friends, Eva Sadej from Floss Bar, to our virtual Zoom studios. These days, we're recording all on Zoom, and Eva is a phenomenal entrepreneur par excellence. She has, in normal times, pre-COVID, she had launched this amazing company called the Floss Bar, and it's a mobile dentistry platform that basically goes to workplaces so that people have easy access to their cleanings, their x-rays, and their whitening. And basically she's devoted herself to making dentistry more accessible through the mobile platform dentistry at Floss Bar. She is young. She won the Forbes 30 Under 30 award last year. Huge accomplishment. Congratulations for that. And then now she's launching this new concept and in COVID testing. And this is what I'm excited about, because obviously we're in the middle of this crazy pandemic, hopefully once in a lifetime. Tell us why you got into this. What was the problem that you were trying to solve?
Sure. So, obviously we're normally a mobile dentistry company, but with, just like the rest of the dental industry, you can't really do dentistry unless it's an emergency service. So, and especially since we're working at workplaces, if everybody's home, like it's a double whammy. So basically out of having nothing else to do, I started this new concept, plus helping with the pandemic. But when you're in a place that's tight, investors are staring at you, and there's a pandemic, and you're a dental executive, so you have to figure out what to do. And so the answer to that was diversify. How do you take your existing resources and fixed costs that you have and actually pivot them to something new? And for us, we were already doing vision and hearing services. Like Floss Bar has diversified before. So it's really just another one of those. And frankly, COVID testing is much simpler than mobile dentistry. Like from a practical perspective, we're doing much more complicated things in the conference rooms than nose swabs and finger pricks. So as a natural segue, once we were able to set up the infrastructure and retool it.
No, obviously, one of the big concerns right now as dental offices start opening back up again for non-emergency stuff, as states start losing their standards and getting the country open back again, one of the primary concern is safety. Safety of team members that work in the dental office, as well as safety of the patients.
Mm-hmm.
And so obviously, how do we make people safe? How do we make people feel safe to go back to the dentist? Is that what your consideration was when you started this idea about COVID-19 testing?
Well, when I started the actual COVID-19 testing service for the workplaces, and I'll go into dental office COVID testing, which is, I think, the fun topic for everyone here. When I started the corporate service, it was really about, hey, let's get people back to work, and let's have people that are working at critical or essential workplaces, as they call them, especially like the food producers and manufacturing and everything, which oddly enough, Floss Bar is very geared for manufacturing. Even if our brand is millennial brand, we'd like do a ton of manufacturing sites. But anyway, so manufacturing industry really needed COVID testing. So it was all about back to work, keeping production lines active, et cetera, and actually cross-utilizing dental staff to be able to be doing the nose swabs and finger pricks. And so in a structure that I'll talk about, of course. But this concept of having the testing done at the dental offices was a natural extension of that. If they're coming with us to help us do all the specimen collections, they've got a flow of patients. You don't have to be at a workplace to have patient flow. It's like you have patient flow. Patients are scared to come. Your workforce is scared to come to work. It's the testing at dental offices is really important.
So this is really a way for dental offices to perform tests on their patients in their offices. Is that what it is?
Yeah, in their offices or outside their offices. If you want them in or out, up to you. We can help you with that. The main thing that this is solving for structurally in the dental industry is that COVID testing is outside the scope of dental care.
Okay.
You can't do it under a dentist. The most important thing is you have to work with a physician group. So we're partnered with a physician group that when we're operating, we're actually specimen collection technicians. There's nothing having to do with the role of dentistry here other than dentists and dental teams can be COVID-19 technician specimen collectors.
Right.
Forget you're a dental office. You're doing something in the interim, cross-utilizing your healthcare knowledge and skill set, but you're actually working for a physician group. And then the second problem is that as the dental market will recover, it'll recover slowly. Like even the ADA is saying next year, even 2021, 70%, not 7% down, 30% down from normal. Because if you have a respiratory epidemic, people are just going to be more scared to go to the dentist, hello, in your face, versus, the podiatrist or whatever.
Right.
And so the cost of customer acquisition, I expect to increase for the dental industry. You're going to be down in revenue and up in marketing dollars, which is a painful spot. So what this also does is that for a dentist opening a COVID testing station, it brings people through the door and it establishes that reputation for them in their community, for one, being a safe place because you're COVID testing everyone, two, doing a social good. So that, it naturally fits in where you're paid to be a specimen collector, but you're getting patients through the door. So your cost of customer acquisition is zero, which is pretty awesome.
Absolutely. I mean, I think it's a win-win situation for everybody, the patients, the team members, the doctors, and overall society in general. So walk us, and I'll ask you questions as I go along because this is full of intrigue. Walk us through the process. I am a dental office, and I'm wanting to reopen. I only see emergencies right now, and now I want to reopen, and I want to go through the process of making my office a COVID testing facility. So walk us through the steps.
So how the process works, and I've drawn out here the practice journey. So the first thing we do is we understand your need. And the way you actually tell us what your need is that you would go to, since you're learning about this from Patient Prism, you go to mobilecovidtesting.com/Patient Prism, and you get to talk to one of our salespeople. Usually it's Doug, as he's fielding all of these. So you'll talk to him about what your need is. And then we start here, right? So you would sign a proposal and a contract with us. There's a fee for setup. So there'll be a fee of $3,100 for us to set you up as a COVID testing station, which includes a bunch of stuff. Next, you're going to select your test kits and materials that you want from the order catalog. We don't upcharge it, it's just a straight pass through. You're going to pay your invoice for this stuff, right? And you're going to receive a bunch of assets, right? You're going to get a digital portal where patients are going to be booking, and it'll be mobilecovidtesting.com/your practice name or whatever you want. You're going to get digital staff training, so that you're taught how to do it and all the safety protocols by our providers. Then you get a shipment of all your stuff, right? Because you selected stuff. And then you're going to get a bunch of marketing templates such that if you want to put your logos on something, we'll do a little bit for you, but mostly you're on your own. And you use that to be able to send out to your patients the information and dates and what to do so that you have that kind of pack. What you're going to do is you're going to collect specimens. And then at the end, here's the key. Here's where you make money. So here you paid a bunch up front, right? And you signed it. You had to pay us their setup fees. You got to pay for your materials and test kits and oh my God. But here what happens is after you collect the specimens, we actually reimburse you your tests that you paid for, your shipping. And for any time that you're collecting a specimen for our group, you're actually getting $35 a patient. And that's every less than 10 minutes. My best technician can do 20 in an hour. So if you just grab a dental assistant, have them do this, you're really able to generate a lot of interim income.
And I mean, so basically it doesn't really cost you anything. In fact, your cost of acquisition is negative. If you do it right, and if you've got a whole flow of people coming in, It's just the initial setup fee. Wonderful. So I signed the contract, paid the $3,100. I select, now the second step is select the test kits and materials. What does it mean? Is it how many tests, how many combination of things can I order from you?
Yeah, the key thing about this is that we're impartial on the tests. Like there's different ones that you can choose from. We monitor supply lines every single day, as well as the science for the test with certifications, the news, and everything. We literally have a full-time human on it at all times, Miss Ruth down in Florida. It's her full-time job to be monitoring the supply. So we have 60 different possibilities. We know the supply levels, costs, and science behind every one of them. And that's really needed for the supply lines too. Like you're hearing all this news that like we can't get test kits. Oh my God, we can't test everyone. And yeah, if you're dependent on like one or two suppliers, you're screwed. And so we're able to give the dental offices that we're working with a real-time update on supply. So it's like, well, you can have this one now or this one later, and here's their price differences. What do you want?
Can you explain the differences between the two tests that are available?
Sure. So there's in the market, there's tests that are antigen tests and tests that are antibody tests. The antigen tests for active infection right now. And the antibody test that includes the antibodies of IgM and IgG. Together it gets about the late stage, like medium to late stage of the cycle, of the disease cycle. So you catch some people who have an active infection, but it's mostly testing for prior infection to see if they have a possibility of being immune. The current tests on the market, the antibody tests, like they're from like 88% to 92% accurate. So it's okay, like mammograms are more in the 70s range if you actually think about what's going on in healthcare. But anyway, they're not the best, but they're available. They can be used. Like there's all this FDA guidance on them. But the antigen test is really the important thing for active infection. So the way dentists are science people, so I don't have to dumb it down at all. But at least for clients, what I say is Jen is sick. Jen is sick, which means antigen sick.
Right.
And so Jen is sick, antigen. And so there's two types of each that are available. So it makes a nice square diagram here. So antigen test, the nose swab kind, they're incredibly accurate. You take a nose swab mid-nose or far up your nose, depending on the brand. You ship it out to a lab, FedEx it, send it to one of our partner labs, and it gets results within 48 hours, at maximum 48 hours. The other antigen test is a nose swab point of care test, where you can actually, at reasonable accuracy rates in the like high 90s, not bad, you can actually get that point of care nose swab done in the office. It's actually self-contained. You don't need like a running machine. This one is on back order up the wazoo, so no one's getting it right now. Maybe June. Hit me up. Maybe June. That's a great one. I want it too. Antibody tests. So there's two types. There's the blood draw type test, which is again like the nose swab. You got to send it out to the lab. Only specific people in the dental community can do a blood draw. I think there's regulation around that one, so mostly dentists aren't getting this one. And then there's the point of care finger prick test. That's the 15 to 30 minute one.
Okay.
And they all have different supply costs, which like the ranges are put here from the market.
So basically, if I'm a dental practice, I'm a dentist, I'm going to sign a contract with you. I'm going to order a number of, depending on whatever vendor I feel comfortable with. And how are people deciding what vendors they feel comfortable with? Do you have some vendor data available on the site that shows you what does that vendor data look like? Is it the sensitivity, the specificity data, or is it FDA approval, not FDA approval? What kind, and what kind of data is available on vendors?
Sure. So it's let's see, what's the data set? Brand, type of these four, right? What are we doing? What are we testing for?
Right.
Sensitivity and specificity.
Nice.
Then you have, FDA status, EUA status, and CLIA status. CLIA is a laboratory grade rating. And then, yeah, the other stuff is just logistical things like minimum order quantity, blah, blah, blah.
FDA status is an yes, no, or applied for, right? Probably 3 statuses there. EU is emergency use authorization, right?
Mm-hmm.
Has it been done that or not? Most of the tests are in that phase. The clinical lab stuff is based on whatever, if the lab is being sent, then that's their certification. So I've identified, I've looked at my vendors, and I'm ordering a whole bunch of antigen tests, a whole bunch of antibody tests, and then they come, then I go to a training with you guys. What does that training look like? Is that like a Zoom training where you can train the dental assistants or whoever team members are on how to collect specimens and how to kind of administer this stuff?
Yes, so the digital training is a set of pretty standardized materials and an exam at the end. We're giving them a test to make sure that they pass. And then a hour to half hour, we've been seeing different teams do different things in terms of Q&A and live chat with one of our client representatives.
Let's go back a little bit to the prescription issues here, because as you said earlier, that this is still the realm of medicine, and
Mm-hmm.
you still need a medicine MD in order to prescribe this test. So how do you organize that prescription to the patient?
Sure. So the patients, they book their appointment, how the practice I showed gets a portal,
Yeah.
custom URL. So the patients go online and they book an appointment and they prepay. So we'll talk about payment flow after, but on your question of how do they get a prescription, right? So they book an appointment, then they're doing their forms. The forms are involving the patient consent and insurance info and whatnot, and then a survey. That health screening survey gives the doctors the information, and it actually qualifies given we have certain standards in there and blah, blah, blah. It gives them the opportunity to talk to a doctor beforehand if they want to, right? And then it also passes the information asynchronously between them and the doctor team, which is synchronous telehealth, which qualifies as a patient-doctor relationship. So by having the asynchronous telehealth visit, or synchronous if they want, gives them the opportunity, that doctor is able to get enough information about them to give them a prescription for testing. Now, the CDC does allow for asymptomatic testing because of local epidemiology. Local epidemiology means a local outbreak, which is basically America. And so the doctors are able to hear, unless, certain comorbidities and, edge case scenarios, are able to give them a prescription.
Right. So you have when the book appointment and pay online, can they do that at their homes? They most likely. So the workflow is going to be like, okay, I have signed up with COVID-19 testing. I got the marketing materials. I have a custom URL. I'm going to email all my patients that, hey, we have COVID-19 testing now. You can book your appointment, go through the portal, schedule the tests, and that's how I get this information to all my patients to basically schedule a test through that. And so they get a telehealth consult, either asynchronous or synchronous, depending on what is there a cost to that for the consult, or is it included in the fee that eventually will be charged for the test?
There is a cost for a synchronous telehealth consult.
Okay. So if you need to talk to an MD like I'm talking to you, then there will be a cost associated with it. Otherwise, it's all included. Then let's say it's Monday. I get an email. I sign up. I do my forms. I get a prescription. Then I show up at the dental office, and the testing facility could be either inside or outside, depending on what you have. You could have a little tent, or you could be, a operatory. You get there. If it's a no swab or a 15-minute thing, you wait maybe somewhere and then if you're clear, then you could potentially come and do your appointment. If you're not, then we say bye-bye. I don't know. What do you say? We kind of get you into the next protocol, right? Whatever you need to do to quarantine yourself. Is that how it works?
Yeah, if you see here, in the 5-step process for them, it's digital, physical, digital, digital. So we're trying to lean out human interaction as much as possible because there's a pandemic. So yeah, they come to the station. Once they did the first 2 steps and forms and prescription, then they go away. Don't hang out. Go get a coffee if the coffee is even open, I
Right.
guess. Go sit in your car. You get your digital result, and then you talk to a physician if you're positive.
If you're
Yeah,
negative, you're good to go. You basically show your fast pass and to the dental, like, hey, this is negative. I'm gonna come in, and everybody's happy. If you're positive, you talk to the doctor and say, all right, well, and go isolate yourself, and they'll give you advice. And is there a cost to that consult after you're positive? You need to talk to a doctor.
there's always a cost if you want to talk to a doctor.
Okay. Okay, well that makes sense.
Yeah.
Um, well, that's great. So it's pretty much a seamless process. You've digitized it, which means you're not having a lot of paperwork for people to fill out and touch them with all the viruses too. So you're doing it all mobile, which is great. Now, the training of a specimen collection and all that stuff is you're seeing good results with that, right? It's seamless. It's not that difficult to do. It's probably easier than what dental assistants and hygienists or whoever it is do anyway. A lot less invasive. Um, what type of PPE is going to be required of this of people who are collecting the specimen, and are you in any way helping with that?
Yes, we definitely are. In that catalog of materials, we bulk purchase a lot of PPE. So
Right.
we have the PPE necessary that the doctor's office can order. Um, if they want to get it from somewhere else, that's cool too.
But is there some recommended PPE? Because obviously the N95 is probably required because you don't know. You have to assume somebody has it, right? Until they don't. So you've got to have the N95, and so if they don't have it, then you can provide the N95 masks and whatever they need.
Yes, and in the training, it's going to say you have to wear it just from us. Like we can help you get it or you have it, but you do have to wear it. There's like a checklist from the CDC, including obviously the 95, the gown, the other stuff, the goggles. There's a whole list.
So this is fantastic, and then in terms of is the medical insurance at all involved in any of this stuff in terms of reimbursement? So who is paying? Are we charging the patients the $44 or whatever you were saying, and then are we then are they going and then submitting a claim to their medical insurance company because they have a prescription? Is that how it's working, or how does that work?
Yeah, I'll go to the slide about patient pricing. This,
Oh
this would
wow.
this will help help everyone understand. So there's 3 types of services the patients choose from. They're either doing, or the practices can choose, they will execute for their patients. So antibody testing, antigen testing, or a combo of those 2. And it has the patient forms will have all the disclaimers on all the things and what it means, and the dental team will read it and be trained and all that kind of stuff. So what happens is that there's price differences between them. Antibody 110, antigen 160, and combo 200. Most of this is covered by insurance. The thing is that the insurance carriers have been very strange in terms of like deep clarity on okay, what about asymptomatic testing? What if they're retested? What do you put actually on the claim form for the different types of tests? Is it different per the codes and whatnot? So because of that, we can't take on or our physicians can't take on the actual risk the insurance isn't going to pay out. So we have to put that on the patient. So the patient has to prepay, and then they would get reimbursed along the flow if their insurance is going to reimburse them. We do process that claim for them.
Oh, on behalf of the patient. So the patient, you will submit that to the insurance company for payment to the patient?
Yes, yes. We don't want like people to do things. We're very control freaky.
So a question, Eva, as dentists start becoming these COVID-19 centers for testing, obviously all of us want to be tested these days, and how do we ensure that it's for our patients, unless we want to be in a COVID-19 testing business, which we don't. Um, how do we how are you coaching these practices to kind of keep it restricted to their patients?
Yes, so it's really important if you're doing any external signage that you put private on it. And again, we help you design the signage, we give you the templates, because you don't want just like the whole neighborhood just walking in randomly.
Well, this has been fascinating conversation, because I really believe that the only way we're going to come back to some sort of a normal after this pandemic or during this pandemic is actually testing people. I mean, Jeff Bezos wrote I read his annual report 2 weeks ago for his last year's annual report, and basically his mantra was, we're going to keep testing our people continuously too, not just because obviously you could be asymptomatic today and test negative today, and then a week later you could be positive. And that's probably the only path for us to reopening our economy and our country and our businesses. And I think as far as our industry is concerned, which is dentistry, what you are doing, and you're making this easy for dental offices to implement this turnkey in their office, is absolutely amazing. What's the best way to get people to sign up for this? We're going to list that on the screen as you talk about them, contact information, website, and all that.
So the best way to get in contact with us if you're interested is to go to mobilecovidtesting.com /patient prism for all of you patient prism people, so that we can track that they are from patient prism. So that's the best way to get there. And what would happen is your inquiry form will come to support, and we'll get one of our teammates on the phone with you for next steps.
Well, Eva, this has been tremendously informative. I think a lot of the people that watch us and follow us are going to love this, our webinar. And I've been wanting to do this for a while. I've been bugging you, but I think you've been figuring out all the components of it. You wanted to make sure you got it right before you got it out to the public. So appreciate the work and the innovation and the speed at which you've launched this national COVID-19 testing for dentistry. It's going to help our industry a lot. So thank you, and kudos and congratulations as much as possible during this time. I think it's going to help a lot of people. So thank you so much.
Thank you. No, I really appreciate it, and I'm here for you guys. So reach out, and thank you for the kind words, Amol.
Thank you.